Hi everyone, welcome back to my YouTube channel. Today we are going to talk about muscles of neck. So let's start our topic with introduction. Neck muscles are a complex group of muscles that are responsible for supporting the head, moving the cervical spine, swallowing, speaking, and assisting with breathing. These muscles are divided into several groups based on their location and function, and they are closely related to important anatomical structures like blood vessels, nerves, and glands. Classification of neck muscles. The muscles of neck can be divided into superficial muscles, suprahyoid muscle, infrahyoid muscle, anterior vertebral muscles, and lateral vertebral muscles, and also muscles of posterior neck that are called as deep muscles. First are the superficial muscles. Superficial muscles include platysma, that is thin sheet-like muscle that is located in the superficial fascia. It originates from the fascia over the upper chest and shoulder, and it is inserted in the mandible and lower face. It is supplied by cervical branch of facial nerve, that is seventh cranial nerve. Its function is to tense skin of the neck, depress mandible, and draw corners of mouth downward. Second superficial muscle is sternocleidomastoid muscle. It is prominent muscle that divide anterior and posterior cervical triangles. It originates from the sternum and clavicle, and it is inserted in the mastoid process of temporal bone. It is supplied by SSC nerve and cervical spinal nerves. Its action is when it contracts unilaterally, it rotates head to the opposite side, and when it works bilaterally, it flexes neck. Then there are suprahyoid muscles of the neck. Suprahyoid muscles are located above the hyoid bone, and they assist in swallowing and elevating the hyoid bone. They include digastric muscle that has anterior and posterior belly, that is supplied by mandibular division of trigeminal nerve and, and also by facial nerve. Then another suprahyoid muscle is stylohyoid muscle that is supplied by facial nerve. The third muscle is mylohyoid muscle that is supplied by nerve to mylohyoid, that is branch of trigeminal nerve. Fourth muscle is geniohyoid muscle that is supplied by hypoglossal nerve, and that is the 12th cranial nerve. Now let's talk about infrahyoid muscles of neck. Infrahyoid muscles are muscles that are located below the hyoid bone. It depresses the hyoid bone and larynx during swallowing and speech. They include sternohyoid muscles that are supplied by ansa cervicalis C1 to C3. Second infrahyoid muscle is omohyoid muscle that is also supplied by ansa cervicalis. Third is sternothyroid muscle that is also supplied by ansa cervicalis. And fourth infrahyoid muscle is thyroid that is supplied by C1 through hypoglossal nerve. Then there are anterior vertebral muscles of neck that are located in front of cervical spine. They flex the head and neck. They include longus colli that is C2 supplied by C2 to C6 spinal nerves. Another anterior vertebral muscle is longus capitis that is supplied by C1 to C4 spinal nerves. A third anterior vertebral muscle is rectus capitis anterior that is supplied by C1 to C2 spinal nerves. Fourth anterior vertebral muscle is rectus capitis lateralis that is supplied by C1 to C2 spinal nerves. Lateral vertebral muscles of the neck include scalenii group that are located on the lateral neck. They elevate rib and assist in respiration. They include scalenus anterior muscle that is supplied by C4 to C6. Second is scalenus medius muscle that is supplied by C3 to C8. And third is scalenus posterior muscle that is supplied by C6 to C8. Then there are posterior neck muscles that are also called as deep muscles. They include deep extensors of neck and suboccipital group. They have superficial layer that include trapezius that is supplied by SSC nerve, that is 11th cranial nerve, that its function is to extend and rotate head and elevate shoulders. Then there are suboccipital muscles that include rectus capitis posterior major, rectus capitis posterior minor, and also oblique capitis superior and oblique capitis inferior. All of these muscles are supplied by suboccipital nerve, that is C1. These muscles control fine movements of head and neck. Functional grouping of muscles. They include Flexor that includes sternocleidomastoid muscle and anterior vertebral muscle. Then there are extensors of neck that include trapezius muscles, splenius muscles, and suboccipital group of muscles. Then there are rotator group of muscles of neck that include sternocleidomastoid and scalenine muscle. Then there are swallowing muscles that include suprahyoid and infrahyoid group of muscles. Clinical significance of muscles of neck. First is torticollis, that is called as ray neck. It is spasm or shortening of sternocleidomastoid muscle that causes abnormal head tilt. Second significance is excessive nerve injury that leads to trapezius weakness and drooping of the shoulder. Third significance is neck surgery, that is the knowledge of muscle relations is crucial during thyroidectomy or lymph node dissection. Fourth significance is Scaleni syndrome, that is compression of brachial plexus of subclavian artery between scaleni muscles. Conclusion of this lecture video. Neck muscles form a complex system that support head movement, aids in breathing, swallowing, and protect neurovascular structures. Understanding their anatomy, innervation, and action is vital in medicine, surgery, and physiotherapy. And this was all about muscles of neck. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.